Hodgkin's disease, also known as Hodgkin's lymphoma, is a cancer that develops from lymphocytes. Cells in the lymphatic system grow abnormally and can spread to other regions of the body. As this disease progresses, it becomes a disease of the lymphatic system because it compromises the immune system. Different signs and symptoms include the following: pain and swelling of the lymph nodes in the groin, armpit area, or neck, fever and chills, continuous fatigue, night sweats, unexplainable weight loss, loss of appetite, chest pain or trouble breathing, itching, increased sensitivity to alcohol in your lymph nodes. Hodgkin's lymphoma occurs when B cells develop a mutation in their DNA. They then divide rapidly and continue living. They cause a large amount of abnormal B cells to accumulate in the lymph system, where these abnormal cells crowd the health cells and cause the beginning signs of Hodgkin's disease. There are many different types of Hodgkin's lymphoma. One category is classical Hodgkin's, which can include large abnormal Reed-Sternberg cells in the lymph nodes. These include nodular sclerosis Hodgkin's lymphoma, mixed cellularity Hodgkin's lymphoma, lymphocyte-depleted Hodgkin's lymphoma, and lymphocyte-rich classical Hodgkin's lymphoma. Another category is lymphocyte-predominant Hodgkin's lymphoma, which involves large abnormal cells, commonly called popcorn cells due to their appearance. They typically have a better chance of cure if found when young, with lymphocyte-predominant Hodgkin's lymphoma. There are different risk factors for Hodgkin's lymphoma. One is age, between 15 and 35, and 55 and older. Family history. Sex, because Hodgkin's is more likely in males. People who have illnesses caused by the Epstein-Barr virus, such as mononucleosis, and a weak immune system. There are 4 stages of Hodgkin's lymphoma. The first stage, cancer is limited to one lymph node region. In the second stage, the cancer is in 2 different lymph nodes, or the cancer is in a portion of tissue or an organ in nearby. But the cancer is still limited to a section of the body either above or below the diaphragm. Stage 3 is when the cancer moves to lymph nodes above and below the diaphragm. It's considered stage 3 then. Cancer may also be in one portion of tissue or an organ near the lymph node groups or in the spleen. Stage 4 is the most advanced stage of Hodgkin's lymphoma. Cancer cells are in several portions of the organs and tissues. Stage 4 Hodgkin's lymphoma affects not only the lymph nodes, but other parts of the body, including the liver, lungs, and bones. There are treatment options for Hodgkin's lymphoma. One is chemotherapy. Chemotherapy is when chemicals are used to kill the lymphoma cells. Chemotherapy can be taken in pills or through veins. Side effects may occur based on specific medications, although it's typical to find hair loss and nausea as some side effects of chemotherapy. Chemotherapy can sometimes be combined with radiation in early stages. Radiation is high-energy beams being used to kill the cells. It's typical of people in early stages of cancer. Large machines move around directing beams of energy to your body where the disease is most heavily processed. Another treatment option is stem cell transplant. This is where you will replace diseased bone marrow with newer and healthier cells. A person's blood cells are removed, frozen, and stored for later, where they may be inserted after chemo and radiation that would hopefully destroy the cancer cells in the body once and for all.